All right.
I know, when he talks about things, it's just, wow, this just goes everything.
Is the L working? The L's working.
It's cool to know.
Is our TV
Can you guys hear us online?
Yeah, we can hear you online fine.
Okay. Oh, but wait.
How are you? That's what he's about, kid. Pretty out there. Yeah. That one is standard. And I always say most important. Which one is? 15 is the lead. This is going to be. But there's the stuff there is.
Terry, do you think county is having an emergency or long-term recovery group having an emergency meeting this afternoon?
Eddie County?
Sneakins. You want me to forward you the information?
Yeah. You can.
I don't know if things are. We're gonna, I don't know. How are they wait forever? And I've had to take out two kids.
So we're gonna give me a reason to make something. I know you. Trusting me that. They're parent lost. Well.
I was all. I was like, take me with water.
Daddy later. Just take one.
Exactly what I got. Yeah, my back to the. You know what I mean?
Yeah, I'm like.
We do, but.
Does- Hey, can somebody online say something?
Something.
Yeah, and then was that something.
Can you do it again?
Yep, how's that? Any better?
Something.
There, we got speakers going.
Yeah, so it's just this.
All right, it is now 12:05, so I think we'll go ahead and call this meeting to order. If you are online, please put your name in the chat box.
Thank you for the sandwiches, Karen.
You're very welcome. All right. There you go. So Tiffany is going to be my viewer of all things Zoom over there and do the wheel of fortune. So, yeah, we'll go with that. All right, call to order at 12:05. So you'll notice that the agenda, it doesn't look like it used to look, so I made a few changes. So for announcements, we're gonna do it as if you have an event or something that you need to relate to the general population of the meeting. We'll go ahead and start with that here at the beginning. Go ahead and when you're doing this, state your name and which organization you're with, and then give us the information. I use AI to record the minutes for me. And when it records for everybody in this room, it says it's me. And I know I'm not that eloquent and I didn't say all those words. So that's the only way to track it. So if anybody has anything coming up that they would like to share with the group, we'll start with the room first. More.
Just a reminder, but Eastern New Mexico Medical Center, Warren Yale. We have restarted our maternity prenatal classes. We've done 2 months and they've gone great so far. We've done about 12 mothers so far. Our next one, I believe, is this Saturday on the 12th. I'll send out the flyer to you, they carry if you don't mind. And then just kind of let people know, it's open to the community, it's free, pregnant, expecting mothers, families, things like that are all done.
Thank you.
What was it called again? A support group?
Prenatal classes, maternity classes, I don't know. Exact word.
Mommy to be
Yeah.
for you and me.
Marty Garcia, Wings for Life, and we're having our registration for the program for this coming year at ENMU Pool on Saturday, July the 19th, 11 to 1:30. Grades 1 through 1st through 5th, middle school and university high, and probably Roswell.
Okay.
We Sanchez for Road to Recovery, and Teresa Davis, for Road to Recovery. We met officially last night as a family and locked in January 24th for our Road to Recovery race. It's gonna start at 10 o'clock. We're not gonna look for vendors so much this year as people to just join the race as a group and participate that way. I know. You were so.
As somebody who doesn't do cold, I greatly appreciate that.
Yeah.
Oh, that was
Cheerleaders.
bad.
We did talk about possibly putting up a huge tent to allow the people that, just make it a little warmer and more comfortable. But it was a cold, frigid day that day, but we still got quite a few race runners and walkers, and it was a good turnout. And we just decided that we just had to keep doing this in memory of our brother Daniel. And so, yeah, we put flyers for you.
We moved it up an hour.
10 o'clock, thinking maybe by then the sun will be a little warm.
Yeah, y'all don't know this about me, but I hibernate in the winter. I don't like cold.
She had the best jumping out there too. She was like,
Oh, I had to go buy one.
oh,
You guys have anything?
I want to tell you, Carrie, I want to tell everybody that, I want to let Carrie know that you all are a great leader. She's doing awesome, getting in all her deliverables, everything that needs to be into us. It's checked. So.
It's checked and cast. Bruce,
Nothing much, except other than the fact that I'm still accepting new clients for addictions counseling.
Diane, do you have anything?
Nothing new, just meeting with schools, planning public events in school.
Ladies?
On July 17th, Molina's gonna be having their member advisory board meeting for their actual members. They will get a $25 gift incentive for attending. This is gonna be the last one that we will be giving a gift incentive for not just the parent, but the parent on behalf of the children as well. So if they have 4 kids and the parent attends, they're gonna get 5 either Visa or MasterCard gift cards. But this will be the last one to do, and I've already sent the flyer over to you, Harry.
Claudia Lopez, House of Kids, Family Resource Center. This Friday we have our Bunny and Me class, which our lovely Valerie is gonna be facilitating. We're still taking, clients if they wanted, they're interested, or anybody that's interested to take in that class, we could go ahead and sign them up so they can reach out to us. So I'll share their information with this one.
All right, I appreciate it. All right, so online, if anybody online has an event or something coming up that they would like to share.
Yes, I do.
Thank you.
Danny?
Wow, there's a picture behind the head. I'm sorry. Okay, sorry about that. I don't know what's going on with my background, but so I did drop in the chat we are going to have a QPR training that's going to be on July 19th. Together Veterans is going to be hosting it, and it is a free training. And all our I know there's limited seats that are available. We are going to be having these we're going to have these quarterly. So if you would like to be enrolled in future ones, just let me know. And then we are going to be working to plan a stand down in the future. So.
All right, thank you. Who else online has something?
This is Rick with the Boys and Girls Club. Just a shout out. We've got the fun run that's going on August 2nd at 7 a.m. Tickets are on sale right now. If you purchase your tickets before July 13th, you are guaranteed your shirt size. After that, it just depends on what's available.
Thank you, Rick. Anybody else?
Hi, my name is Nerida and I'm from La Casa Family Health Center. We're gonna be having it's a nation celebrating the National Health Center week celebration on August the 7th. If anybody would like to be a vendor, feel free to contact me. Again, it's gonna be on August the 7th at our 1511 South Grand location from 3 to 6. And Molina's gonna be one of our sponsors that's going to be giving out backpacks filled with school supplies.
And I just want to thank the council for donating the jump ropes to the event. Thank you.
They should be here, I think, this week, Elizabeth. They've already shipped, so yay.
Thank you.
Anybody else?
There's something else on August 2nd, isn't there?
That would be down here on the agenda because those of us that are in part of the health council, we have our own dedicated lines. Who else?
Hi, this is Rosia with the Roswell Public Health Office. I have vaccine events for children. July 21st through the 25th, 8 to 11, 1 to 4. And then again, August 4th through August 7th at the same time, 8 to 11 and 1 to 4.
Thank you.
I'll go ahead and go next. This is Sarah Bowen with Department of Health. I just wanted to take the opportunity to introduce Mia Peacock, who is the coordinator for Eddy County Health Council. And I just wanted to have her on the call today to see how it's done. Chavez County Health Council always does amazing work. So just wanted to introduce her to you guys. And if you need anything, we are so happy to collaborate with you. Thanks.
No pressure there, Sarah.
Yeah, I never cause high pressure situations ever.
Thanks. Welcome, Mia. Anybody else?
Were we doing introductions and I missed it? Sorry, I had to run and answer the front door. Jesse Hernandez with Alianza.
Welcome, Jesse. Do you have anything to announce to the group?
No, it's my first time actually being able to attend. Thank you all so much for all the work you do. I'm glad to be in collaboration and glad to finally get to be in one of the meetings.
Glad to see another familiar face, Jesse.
So one of the things that I changed is I want to put more content into our meetings. And part of that is when I did the math last month, if we have roughly 20 people in here and I give everybody about 3 minutes to talk, our meeting's over. And we can't get into any content. So that was one of the reasons for the changing. It's not that I don't want to know who you are and where you're from and sharing, but just making sure that we just get the information out to the public. I think one of the other things is that if we're gonna have events and announcements and stuff, have you guys give me that information 2 weeks prior to our meeting, and then I can include it onto the agenda and put all that information out. This way they can see it in writing instead of trying to take the notes or understanding, or paying attention, because that's my bad with Zoom. So try to streamline some of this. So our membership, we ended our last fiscal year with 95, and we've already jumped up to 96 for this fiscal year. Yay! So welcome Clyde, with Sacred Space Support Group, Stephanie with DOH, Cassandra with Eastern University, David with Rustic Health. Yep, and I don't know if any of y'all are on, but welcome. Consent agenda. So if you want to review the minutes. One, check, make sure your name is on there that you attended. Last month was a full Zoom meeting. And so some of the stuff may not have come across right because not everybody uses their full names in their Zoom logins. And then if nobody sees any changes, we will just move on. We're not gonna do any exceptions. We'll just make changes if there's anything that needs to be changed. All right, at this time, I don't have any funding requests, any sponsorship requests for this month. That was just there so that way you can see kind of where it's gonna fall into it if we get any going forward. So then we'll move into the Health Council activities. The first one is the Behavioral Health and Wellness, Elizabeth.
Good afternoon. So our last meeting for the Behavioral Health and Wellness Committee was held on June 18th. I wasn't able to attend, but I took some information from the recorded minutes. So they did discuss the mental health summit that took place in 2019 and also the strategic planning meeting that took place in 2022. They're going to review the summit report and the summit brief and kind of look over some providers that might be able to assist with us moving forward. What we're looking for is possibly a tool that we can use to put out to the community. Valerie Lopez is going to be communicating with Dr. Christensen with the Project Echo to see if they have any useful tools that the committee can use. Valerie also discussed requesting HCA to come and give a presentation on the Behavioral Health Reform and Investment Act. They already did one. I believe there's a link that's been going around if you want to look at that. That way she can come and do a presentation either in this meeting or in our Behavioral Health and Wellness Committee. And that's all I was able to gather from the information that I had. If anybody else was in attendance and there's something else you want to bring up that we discussed in that meeting, please do so. We do have our next meeting. I forgot to write that down. It's next Wednesday, correct, Carrie?
Yeah,
Yeah,
July
it's
6th.
Okay, thank you for that.
Thank you, Elizabeth.
You're welcome.
Education.
Sorry. Did you turn on the audio?
I didn't need to.
All right, the Youth Education and Awareness, Geneva is somewhere in South America living her best life. And I'm, yes, jealous about it, but I do know we are moving ahead with the ZAG Youth Entrepreneurial Fair. It's scheduled for October 25th. membership or applications will be worked on soon. She's working on getting all the sponsors to be able to pay for the event. And it will be held at the Boys and Girls Club, thanks to Rick. But I'll have more information once we get to that, but we're getting close to start pushing it out to the community. Food insecurity, Evangelina, are you on? No. All right, so Evangelina's not here, so we'll skip that one. Danny, do you have anything else with Together with Veterans? Since you shared the QPR training that's scheduled for next week?
Yeah, it's July 19th at the Boys and Girls Club. Nope, we're good. Thank you. And I did drop the flyer in the chat.
All right. All right, Health Expo, Jennifer's not on, so, we are done. I've had a last few minutes this week request for sponsorships and booths. I'm giving everybody to the end of this week and then I have to cut them off. There will be no more exceptions. But when they ask to sponsor, it's kind of hard to turn that down. So we've got, the last lick was 56 individual booths. And it's looking at right now about 95 tables. There are a few of you that still need to get me your booth forms that are sponsors. And I will send that out and remind you yet again, because I have to have that because I have to be able to move forward. Everything is on order. My office is filling up. We have no more space for people. I have flyers, so some have been passed out around. I have a few left here if anybody here needs them to take. I emailed out a copy, so if you can send them out to everybody in your email list and then put them up if you're in public areas to get the word out, it would be greatly appreciated. Both billboards are up as of today, which was a shocker come Monday when I'm sitting out there going, where's my ads? So that's where we're at. The Health Expo will be August 2nd from 10 to 2 at the Roswell Mall. If you're a sponsor, you should have gotten your email with your code for your free entry into the race and to order your t-shirts, because the deadline for t-shirt entry or to guarantee your t-shirt is July 13th. If you don't register by then, you don't get a pretty shirt with Pac-Man on it. Yep. And then remember, the race benefits the Boys and Girls Club, so spread that out as well so that we can help them. All right. With that being said, now we get to the fun stuff.
While you're doing that, Carrie, I just want to just give you all the kudos in the world because you and Jen having to pivot to do the Health Expo at the mall. Hearing that there are 50 plus vendors, that's about half of what you're used to, or less than half of what you're used to managing. No, isn't it 100 vendors that you?
Booths.
Oh,
It's usually about 109 booths and usually some 55, 60 vendors.
so
And-
you're about at the same pace.
We're about at the same pace, and we actually may end up with a little bit more.
And that's quite impressive compared to what you've done in the past, right? I mean, having to pivot, having to make alternative arrangements and having to figure that out. I mean, kudos to you guys. Kudos for this community. It's huge. So thank you.
Thank you.
And Jen?
And if being growing tax-free weekend, it's gonna really be a big deal.
Yeah, so right now the deciding is, do we want to bring the helicopter from Aerovac?
So much fun that year that we had it there. It's loved it.
Yeah, I mean, generally speaking, they always try to get out there. That's something you want. We just have to find a spot to quarantine.
Yeah, and then make sure that they can take off. Getting in is not the problem. Getting out maybe.
I think they brought, I don't know how many of those little flight pins that they had given them all away like within an hour. It was hugely popular.
Yeah.
I just love it.
I'm thinking that I'm leaning towards it. I wish the city would do more with us and we could get the fire and all the other stuff, but future goals, we'll get there.
Get you the link for the part.
I'm good. All right. So again, as you notice, the agenda has changed quite a bit. One of the things that we're doing is we are gonna work with Dan at 100% Chavez County. And we are gonna tie what we do with the Health Council into his vital services. So we're kind of killing two birds, one stone. But we're already kind of doing this anyways. One of the things I felt is that you guys didn't need to have me sit up here and tell you what I did for my month because, well, that just seems stupid. We need to figure out what's in the community and how to help and do more inside the community and that piece to it. So I sat here and I ran an idea through my friend Sarah, who said, hey, I like where this is going. And of course, letting her know that we're tying this with Dan and everybody was like, yes, this is what we want to do. So what we're thinking is that for the last 30 minutes of the meeting, we can set it up so that we have a specific topic each month. We can have a couple groups come in and give a spiel on what it is, but that spiel needs to be kind of geared to the community, because really what I would like is the community to be here, because we know who we are and we know what we do, but what we need is for them to know what we do and get this information in. I mean, it's great that we can share this with our group, but I think we need more community input. I think that's what's kind of missing. And if I'm off topic and you guys are thinking she's crazy, just let me know, speak up. And that goes for y'all online. Don't raise your hands, just jump in. So when we're looking at this, trying to tie our topics into the 10 vital services. So that's the parent support, early childhood, community schools, youth mentoring, job training, transportation, behavioral health care, medical, dental, housing, food. So what I'd like to do is sit here and have a discussion on what we would like to talk about each month. And it doesn't have to be what you do. It could be something that you know that the community says, hey, you know what? The community really could use some suicide training. Maybe we need to do something for this, and we can go through it, you know, because it's more than just the QPR. Maybe it needs to be with cutting for the schools or all the different pieces to it. It's just because you guys are out there, you see it, you hear it. What can we give to the community to try to engage more? So we have 9 months where we actually do presentations. November is our potluck month, so no presentation on that. And December, you guys all get a break because it's Christmas. That's my gift to you. Because you don't have to see me. Okay, it's
Can you make the first one vision? We have no good eye doctors here in Roswell, and everybody's having to leave out of town.
That are covered by them.
Yeah, now we have to pay out of pocket, because money to pay out of pocket.
That's true.
It's killing us. Warren, we need help.
okay.
It's a problem with the southeastern corner. Huge problem. People
I
have to drive
got
3+ hours.
IMAR expressed that they're closing the vision.
Yeah, my doctor sent me my medical records, that's good read.
Yeah, closing down.
Okay. So what we're gonna do is we'll just start making notes and try to see how we can fill it in, because remember, okay, if we're gonna bring in somebody for vision, we need somebody who can come in and speak on vision and give information. And what you're needing is you want more providers.
Yes, or a provider that will take our insurance, so we don't have to pay out of pocket. Or go what is it, Albuquerque, El Paso, blah, blah.
Ruidoso did have somebody, they had vision,
Okay.
given their.
Okay,
Yes.
sorry, that's a whole different topic, guys.
Yes,
Let's
sorry.
stay on. Okay, so if we use what I did with the overdose prevention and kind of how I saw this going, okay, so that was way, instead of just shouting out topics and we kind of get off kilter here. So if we look at, and I just made stuff up and I just put people in things. So like if Alianza wanted to come in and talk about harm reduction, and they would discuss naloxone training, because they can do the individual training. Who does the train the trainer? How can we get to make sure that all the rec staff with the city or the people in the hotels, all of the community is trained in Narcan training or whatever else that we need, and discuss that, safe medication practices, information the community needs, right? And then of course, seeking help and support and reaching out to that. And they would do their spiel and provide that kind of information out. And then, health council could come in and say, okay, with overdose, this is what we can do. Here's our public awareness campaign for the month. This is what we'll focus on. These are our topics, because the group said, you know what, overdose prevention is huge. Maybe we just want to focus on this one area, and that will be our campaign, and we'll do it on social media and we'll push it out everywhere. So that way, at least we're getting more information out to the community, because it's going to take a while to build this. And so it'll be slow to start with. But I think if we do it right, I think we can get some engagement, hopefully. And then at the end, I want to talk about the community partners. Okay, so who else does this information? So if we're looking at overdose prevention, we need to say, okay, well, here are counselors that do this, who deal specifically with substance abuse. Thank you. And then here's who we have that can do intake and the homes for them. See, this is where because I consider myself part of the public. I am not knowledgeable in all this stuff because I don't operate in this world. I mean, you have to sit here and think about it. It's only been a year that I've been inside of this. So you have to train me at the same time. And so whenever I don't know the answers to stuff, I'm just like the general public with a little bit more knowledge. So if I don't know about it, I can guarantee you they don't know about it. So that's kind of what I'm looking at trying to build. Does that make a little bit more sense on what we're looking at? So some of the things that we talked about was overdose prevention, maybe cardiac issues, senior living, pediatric care. We have the things that we deal with is the food insecurity, which of course we'll bring that through on our subcommittee. Together with veterans, we'll deal with that on the subcommittee. Behavioral health will have some things, but we need more to it because there'll be a lot more. So opinions, thoughts, processes, ideas.
I think collaborating is amazing. I just like it doing the whole two birds, one stone. I think it's really gonna help us out, and we're gonna be able to build out on a way that's a lot more streamlined. Or retention more subjects with purpose.
Well, and one of the other things I think is because everything here, Chavez County is so big and everything is focused inside Roswell. We have the valley, we got 3 communities that are 20, 30 miles down the street, but we don't go to them. I mean, some of y'all do within what you guys do in your capacity, but as a health council, we do very little interaction. And so one of it is whatever we come up with on these topics is I'd like to talk to them in the valley and say, hey, you know what, can we do once a month and do a presentation to the community and get information down there so that way they have information as well. So those are the ideas to keep in mind as we're kind of building this. Anybody online have anything they would like to say?
Thanks.
I'm good. Thank you.
Dan, do you have anything you would like to add into this since it's kind of tying it in with you?
No, I really appreciate it. I appreciate working together because I felt there was no reason for us to have ongoing meetings or anything like that. Well, y'all are already doing this. And so I appreciate y'all really taking up the lead on it and opening this discussion up, especially so that it can get more information out to the public. You guys at the Health Council already doing a lot of this work already, so it's just acknowledging that and making sure that we don't duplicate those efforts. I feel that what you're talking about with trying to do like a 30-minute didactic at the end of these kind of Health Council meetings is a great opportunity for everybody in the community to learn more about what is going on. And maybe this could be some of the ways, as y'all are talking, for example, on the vision area there, maybe somebody has some solutions, some ideas, and can bring those up and brainstorm those as a last 10-minute kind of a thing. We know, and 100%, we all understand that there's a lot of gaps in the community, but there might be other people from other communities. Sarah Jo, I'm glad you're on the call because maybe you know of other things that are out there too that might be brought into the Travis County Health Council meeting too. So Gary, Val, Jen, I really appreciate the help on this too.
If you're educating the community, one area might be the presentation that Kim Runtley did at the summit on her youth group focus groups as to what was going on with them. And that was, if anybody went to the presentation, that was crazy. What kids want, what they're seeing. One of the examples was, we're telling them not to drink, but at their own birthday party, families, it's a big beer and alcohol fest. Or at a baptism, or, there's always alcohol, but we're saying don't drink. But it's there for you, and it's okay because you're with family. So stuff like that. Her presentation had a lot of good information to get out to the public, educating them. That might be a good one.
No, and to me, that would fall into when the behavioral health piece to it, substance abuse.
Even the youth one.
Youth one. So okay, so let's think broad categories, because then we finalize the little stuff in between it. So like if we want to say that one of these needs to be youth, okay, so next month we're going to talk about youth. What would we like to talk about in youth? So it needs to be substance abuse, suicide, that kind of break them down. Does it make sense? Because we're going to have to build almost a curriculum for it. It's only a 30-minute curriculum, but it still is. We got to pull all these pieces together.
So just so I understand what you're saying, I think I'm still trying to formulate what you're saying. So we want to hit on the months that we don't have a presentation, we want to hit this particular topic, or is it the months of the presentation, or is it forevermore?
Forevermore.
Okay. So
I want to take these meetings here,
and turn them into what you're talking about.
presentations.
And you want to hit one of each of the 10 categories each month.
Okay, so no, it doesn't have to be inside of those 10 vital services. So let's say, because food. Well, okay, let's go housing. Housing will be really hard to do a 30-minute spiel on to be able to discuss it. But we are having information on youth. Well, while we're talking about youth, we hit into housing. So it may not hit those 10 categories right there. It's just as we're building it, we need to say, okay, does it tie into one of those so that we can cover that area of it? If that makes any sense.
And you're looking for a guest speaker or a topic or what are you looking?
So right now we're looking at topics. So like we know what is Heart Month, March. When do you wear red? November? February. I have a calendar. I will get these things down. So let's say February, we want to do Heart Month. And so then we can say, okay, what topics do we need to cover on heart? So, exercise pieces to it. Who provides, so like if you need checkups on screenings or something simple, kind of something, what information would you get out to the public? So if you were doing an awareness campaign in your facility for the public for Heart Month, what information would you put out? And with that is, okay, do we need to address anything for the kids with heart? You know, and if there's something that, you know, that would fit on that, you know, don't do drugs because, you know, your meth will make your heart explode. You know, we can tie it in that way. Parent support, parent support. So you have a child with heart issues. Who would you contact? You know, what would happen here? So this is where children's medical thingy through DOH. Yeah, where they might have information. And so most people, because I didn't know that CMS existed. I still not 100% sure on what all they do. Because it was a huge presentation. But it seemed more of niche stuff, and unless they're in that world, they may not know about niche stuff. And then people here, sometimes when you get catastrophic news, you shut down, you don't know how to function, you don't know how to move forward, and then you're stressed out, and then this leads to a whole nother set of issues. And so if we stop keeping that information to ourselves and find a way to talk to the community and make it available to them, I think can help the community.
Providers, cover your ears. I'm not a provider, I'm here. Telehealth services, but these people already are not going to the providers because they don't have the transportation to get there. We need, like, a lot of people are, they're not getting the help and they're intimidated by doing anything telehealth. And a lot of people would benefit from, like, teenagers that need mental health services. They would benefit from being able to figure out how to use the mental health, you know, Zoom dates, stuff like that, like, because their parents are not gonna, the office hours are 9 to 5. Their parents are not gonna get out of work, pick up their kid to go to the therapy, then drive them back to school and then go back to work. They're not gonna do that weekly or bi-weekly.
I've got teenage clients who do their telephone appointments by their phone, so it's totally doable.
So one of the months we could talk about telehealth and then what services are available in telehealth and where we need to stop with some of the stigma and trying to.
And how easy it is to actually use.
If I can figure it out, anybody can.
Well, there's so many people that are, like, just intimidated by it, but.
So, and this is a perfect thing. So telehealth is a big topic. Inside that telehealth, we can talk about parent support. We can talk about early childhood. We can hit some of those 10 vital services, transportation, things that we're not going to do as one of our main topics. See how we're connecting the pieces together? Does that make more sense now?
Like La Casa is not gonna do the school-based health clinics anymore. So those teachers are gonna miss school. Then, you know, substitute teachers are gonna come in, like, it just, everything is ripple effect. Teachers are gonna miss out on that one day and they're not gonna be able to go another day to their kids', you know, recital because they missed out on that one day that they need to take a day off. Where instead, if they have an ear infection, they just get on their phone for 10 minutes. Stuff like that.
I got telehealth now.
Sorry, and I'm just thinking about the health council in general, so I love the idea of the didactic and the education session, all that. The big challenge I see, this from your point, Carrie, like you know, I would argue I'm trying to be well connected, and if I don't know, then probably the community doesn't know, there's a lot of things I don't know. And I'm always surprised when it comes up, but all that being stated is the health council's purpose, because, like, you're gonna be educating people, like, we're pretty well informed, and we'll learn a little more about telehealth, this vendor, that kind of stuff. But should they be topic related or more resource related? Like, for example, telehealth is a topic, but hey, Warren, can you talk about what Easter does? Can you talk about how your practice does? And then at the end of that, you then consolidate a resource list that you set back up. Because otherwise, I mean, we talk about the value of telehealth. I think generally speaking, the community in here understands that component. We're not the general public, right? We're hypothetically a bit more well engaged. My concern is we're kind of, we don't want to become just an echo chamber. We're like, yep, telehealth is a good thing. We all walk out, yep, telehealth is still a good thing. Rather than walking out without some sort of tool or resource that's like, oh, cool, now we have 3 more connections or something you can add to the website or.
And that's exactly what it is because
that may be where you're going with it.
That's exactly where I'm going with it, because, okay, so several people, I don't wanna cut out all those that would provide telehealth, right? They're, oh, it's telehealth, I do this, I don't need to be part of it, I'm not a speaker. Well, no, you need to be here because we need to connect those resources. It's like, okay, well, who all provides telehealth? And maybe it's not you, but you know other people who do it, and it's not, we're not thinking about it. So this is where we would build those resources into it. And then that's where the community partners, that collaboration there at the end. And that's how I want to tie it together at the end.
And the other concern I just see with this model, I'm not saying we don't do it, is you're gonna end up having to manage who's gonna do, like, who's speaking next month. And we all look at each other, put our heads down, and who's speaking next month, and do you have your presentation? And that's like, how do you coordinate all that, or do you just kind of open the platform, like, hey, Easter, you're gonna talk next month for 20 minutes on primary account, whatever you want to say, whatever topic, but is it like more of a general assignment? Do people sign up? Do you pick it? Is it topic driven or facility driven? It's
Topic driven. And then I figure those who,
if you don't assign the ownership, you'll end up owning it. Then I know you've got a lot of other things.
yeah, well, and I can't speak on those topics because I'm the general public. I don't know these things. When I'm building resources, I'm like, crap, I don't know what that is. I mean, I'm driving down the street and I'm writing, wait, what was that? So that I can go and look it up because I don't know what that was.
And I do the same thing. Like, oh, cool, I didn't know that person was here.
Yeah. So yeah, I'd like to pick the general topics and it doesn't, I mean, we're not gonna sit here and schedule them out because we may say telehealth and we have nobody who wants to speak on telehealth. So then that topic was not a good topic. So then it's gotta come off and then we'll have to come up with something else. So once we can kind of narrow down kind of like what we would like to discuss and put out to the community, then we can go back out to our membership and say, okay, any of you guys interested in any of these? And you can say, oh, you know what? This is my area of expertise. I'm really good at this and I love to speak in public. Not everybody wants to do public speaking is the other part to it. And so we get the requests on people who want to present stuff. And it was done every other month. But I figure if we do it kind of, this is how it is, people will come. I think if we build it, they will come.
So at the risk
Are
of jumping into this
Services
conversation
all
late,
use related?
No.
Or can they, because I noticed it's like there's a lot of youth things, so the topics then don't necessarily need to tie specifically to youth things.
No, they don't. So
Okay.
senior living is down there as an example.
Got it.
And the vital service that could go with senior living would be like transportation, food, housing. Who has these things? How can I help when I get calls from the 65-year-old who needs help with something?
Medicare ship coordinator, I can connect you there. If it's that they need to apply for Medicare savings program, we can connect you to that. Yeah, okay. I just wanted to make sure it wasn't just tied to youth only because most of those look kind of youth related. And the way I'm reading it, but it's not.
That's Dan's 10 vital services. So that's the 100% areas.
Gotcha.
So we're tying what we can into it. We won't hit everything every month. But between food, transportation, housing, behavioral health, medical, we're gonna hit something in his 10 vital services that'll cover.
I think, and you kind of just triggered it earlier when you talked about like the heart, about cardiac care and being in February. I think a good way maybe to find some topics is to look at those like this month is mental health awareness month and this month is blah, 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 right? And that would be an easy way as you're trying to find topics. To not, be racking your brain for the topic, just try to use some of those topics, maybe when you don't have something for that month, and then letting the people that provide those types of services or that can relate to that in some way, speak on those.
So that was my backup plan. I've already got a spreadsheet with, I think I've started on national, but I will bring it into everything, everywhere and start tying them together and it'll be a calendar so I know what's going on. But
so
yeah.
if I may, from the online community, I'm struck by a wandering focus in the conversation. If we're the Chavez County Health Council, our job is not to deliver services, but to identify services and increase the awareness of the community of the services that are out there. Not direct them, not influence them, but provide them information. And I think we need to be careful there because we have a group of doers. And so as soon as the doers identify something and they've got, quote, a victim on the line, then we want to carry it all the way through to the other end and save their butt. That's not our job. So many people don't know what's going on in the county, and much of the county who's providing services doesn't know what's going on. So the health council is like a clearinghouse. Here's what it is, here's where it is, here's what they're doing, here's how to contact them. Period. Done with that. Next. Otherwise, we're gonna get in a trap where we're, I think, overstepping our mission by going from providing to doing. And that's not an uncommon thing with community outreach.
Well, so as community outreach is basically, it's what you just said is, here's what the services are and trying to connect them. I don't want to be the doer. I don't want to do anybody's job. You do you, boo. I just want to, because the whole, the coordination, collaboration, what is the 3 C's? Coordination,
Collaboration and commitment, I think.
yeah.
Communication. Oh, yes.
I'll take commitment. So kind of everything is trying to target into that, the coordination, the collaboration, and the commitment. We need to be committed to collaborating the resources. And then this is how we'll find some of those holes on things that are missing. But I don't want to, I don't want to be technical. I don't want to provide that stuff.
I think the hard part is that there has to be an equal investment from both sides, right? So here, the Health Council, its real intention, it originally was for us to be like that clearinghouse, like Dr. Fraga says, right? Like we were the resource disseminator. And always, forever and ever, people go to the Health Council to see what the heck was going on in the community, because we were always getting those emails. I think that just my thoughts are, is that it has to be equally, represented in the sense that we come to these meetings just as much as maybe the community might want to know the information. So we've got to receive a benefit for us coming, as well as the community receiving a benefit for them participating in our health council meetings. So it's got to be equally beneficial. If we're going to come and sit and attend a meeting that, really it's not going to be as informative or as, resource gathering as we intended, maybe we can pivot, right? Like, I think it's a great idea. I think it's genius. I think it's going to be work heavy on your end, because you're the one that's directing and herding the cats, and you're always going to be, because we are space cadets, right? We'll show up. You tell us when to show up. We will show up. You feed us, we're going to eat, but we're going to sit here and look at you. And I think that that's kind of the hard part of your role and the hat that you wear, and that it be meaningful, right? Like maybe a couple months we do it and we're like, so I think it's just gotta be, it's gotta have that full intention of from start to finish and what that vision looks like. It's a great idea. I don't know if it's gonna be beneficial on both ends, like for those of us that are coming, right? Maybe that resource is something that wasn't beneficial. Then we've gotta be able to see what that's gonna look like for the health council as far as the meeting presentation, or the way that the meeting's being held.
Hey, this is Danny, Danielle Thompson. So I just had a kind of thought in regards to some of the things that were being discussed. Is there a way that maybe so you know how the sheriff's department or fire department or whichever, I don't know who exactly, so somebody correct me if I'm wrong, through the schools they do the DWI annual event, right? And so what if there was something like that for maybe with gun safety, especially with the recent accidental shootings, that could be beneficial, or even internet safety for kids, because we are moving into a more modern time frame where it may not be as discussed as much. What do y'all think?
So Carrie, you all have your new deliverables coming out, and you have a big on your plate. It's gonna be a lot. And so that's where we're all gonna have to come in to help Carrie with those deliverables. So depending on what she chooses, or the executive, that's where we're gonna have to come in and help her so they get their funds. So we don't wanna do too much or have you do too much.
So, but part of this is all tying this together. So I'm looking at my deliverables and trying to pick those pieces. And because I don't know if you figured it out or not, but I'm not leaving any money on the table.
Yep.
I will find ways to take it. One of the things when I put out the survey to the group, the biggest response was more information on resources. Well, that's the collaboration piece, right? That's gathering that information. Well, I need people to provide that. I mean, I can sit here. I have the resource guide, but it's only gonna be this good because this is all I know. And if I don't go out and say, okay, what am I missing? Who else is out there? If we don't have start communications around it, we won't know that it's missing or it's out there.
And some of that can be provided by the people who we already have on there. I mean, I do what I do, and I'm aware of what's not in the community, just as I would be aware of what's in the community. And so my place is with the what's not, because that's part of my livelihood. But somebody's calling me on a referral, I'm going to listen to what's going on, what they need, go through my own data set of who I know, and refer them on, or refer them on to another aspect or another entity that may be able to provide them with some more information to keep them going. Again, is to keep the ball rolling, open up new doorways, but the patient, client, subject got to walk through them on their own. Ours is to say, this is what's going on. We're a small community, but you know what? We are not very well informationally coordinated. We're not. It's amazing to me that people who lived here all their lives and still don't know that this is going on in town, or that one's here, or that one's left, which makes it very difficult when you're trying to get something done.
And Sarah Bowman put in the chat, and I think she has a great point, that we could record the presentations and make it part of our social media.
Which, by the way, everything in here is recorded and I can snip it. And I can snip it good.
Yeah. They're easy to do, and I think it like builds onto what you're trying to do, like reaching out to the community, because then you could cross post those recordings to community groups as well, just to get the word out.
Okay, well, we're getting close to time, so maybe I was a little over ambitious thinking that we could fix stuff. But mull it over. You all have my email address, you have my phone number.
Not to kind of get us off tangent here, and I apologize, but like I'm going back like 13 years ago. I think I was on the health council. We were on the health council back in 2013. 12, 13, 14, whatever. One of the things they used to do, and I'm not saying we want to do this, it's a completely different way of doing it, but they would move the meeting. That's hard to do too, but it would move it to a different location. So we did that back then, and then you learned about back then. You did it at Easter, you learned about this one, you did it at Publish, you learned about this. So it kind of moved the council around town, and then you also got to see facilities and meet people and network with the staff that don't always come to this session. This is very nice because it's a central place. People know where to go. There's a time and place, but I know I went to more of those because I got to go places I hadn't been before. I got to meet people I hadn't met yet. I love all you guys. I want to meet you every month, but it's kind of like, a part of this, I think the value of this organization is the networking opportunity. Like, okay, hey, you're new to town or new service, or I hadn't met you before. And Eastern Right Rock is kind of like the health council. It kind of has a lot of connections, a lot of places, but even we struggle to keep up with them. So just to make it extra confusing, I don't think we need to vote on it or change anything. But I personally I went to more meetings back then because I was like, oh, I haven't been there yet. I wanted to meet that person and encompass us most. Have whoever.
I think there's a place for that, and I agree. I just would not want to see the council challenged with that every month. So people are trying to figure out where the hell they have to be and where they're going. If it was a by every other month or every third month, then we would see about maybe the new kid that's coming in hosting the meeting that month as a means of everybody getting familiar with it and so on. I think that's a good idea. I just don't see it as a monthly rotation.
It worked because I was part of it, and even DOH hosted 1 month. Valerie was with us, Mecca and you two people. And the good thing is they provide food. Whoever's hosting it has to provide food to everybody.
And you're very food focused.
Also, you can still do Zoom because we did Zoom for Mecca and a few people joined still.
Danny included in the chat that we could also make it a business after hours kind of thing.
Yeah, and there's always, I mean, there's rooms to grow and kind of, all I know is that last year I stuck with the agenda that I was given and the way that I was shown on how it was done. And I asked myself, would I have come to this meeting? And out of the 9 meetings that we had, felt like way more than that to me, but okay, out of the 10, my answer was no. And if I feel that I couldn't give up my hour to come here, how can I ask others to give up their hour to come here? So it's like, we gotta find a way to make this more engaging, more informative, more resources, give the people what they need. Build it, they will come. The other thing that I know is when I'm around the community, the number one question I'm asked is, well, what does the health council do? When I go to a meeting for a behavioral health event and I'm told I can't go in because it's only for the elected officials, we'll deal with the nonprofits later. It's like, wait a minute. We're mandated by the state that we have to be in existence through the county, and you're telling me I can't come to a meeting because I'm not the police chief? No, you've got La Casa here, you've got Renew Health here, you have this group here, this group here. I'm not just a nonprofit. So what is it you think I do? What is it you think the health council is? We are just as important between 211 and the health council. We're just as important in connecting and making those resources that those other groups are doing. And so yesterday I was just a little pissed off because I don't think, I mean, I stayed for the meeting because Judge invited me and he was invited to be there. And so I wasn't walking out. But I think the community needs to know more, and the community, including the elected officials. So, with that, it is, I don't know,
103.
1:03. If anybody has any dying remarks that they need to make, speak now or forever hold your peace for 2 minutes.
30 seconds. If anybody needs any information about applying for Medicare Savings Program that can help pay for Medicare, if you know someone, please tell people Medicare is not sending out new Medicare cards. That's a scam. If somebody calls them, wants to verify their information, that's a lie. Medicare is not calling people asking to verify information. That's a very active scam. If they need help, also ADRC is great for aging, long-term services. And I've got information about Medicare scams, frauds, and getting help paying for Medicare and prescription drugs. So if anybody wants any of the information, feel free to grab it. And thank you. I was on calls earlier, so I'm just running in on the way.
Okay, I'm not sure. I'm trying, I just don't know how. Oh, stop sharing, there it is.
Also says I need to be a.
What?
Okay, let me go down.
All right.
You'll notice the upgrade to our wheel, it now has the logo in the middle of it.
All right, I added everybody's name. Everybody, we're good? Good opening. How's it been? Rocio, who is on online.
Oh. Yeah, all right, Rocio, I have those in my office. We'll get together and get that gift card to you. With that, thank you guys.
Thank you.
Does anybody need health expo posters?
Yeah, I'll scrap.
Yeah.
You noticed who I was looking at, right?
Yeah, but why? That's no problem.
Yeah, whatever you want and as much as you want. I've got more back.
You know, maybe 5 more.
Okay, this is the.
Take it.
Right, take more. This Medicaid and Medicaid basis. And it's got just information about the video for the growth of. Service last night.
Okay, thank you.
Yeah.
Think we got it all ironed out, is what I heard.
Any of the other.
All right.
Welcome to anything.
You're doing good, Carrie. Keep it up.
Thank you.
You better.